Definition: endometrial strike with the use of Fafayazi is a technique purpose to facilitate embryo implantation and decreases the probability of the pregnancy.
My name is Erica Johnston McInerney. I'm a reproductive endocrinology and infertility specialist, and I see patients here on the Henrico Doctors Hospital campus for HCA. IVF, we talk about it so much these days. I think people are becoming more aware that many women are using this technique to build their family. And for me, that's thrilling because I'm happy that people are talking about it and supporting each other as a community. So IVF stands for in vitro fertilization, referencing the fact that eggs and sperm are actually taken into the laboratory to fertilize and actually make an embryo. The embryo is then returned to the patient's uterus in a very simple transfer technique that's done in the office setting. So the benefit of in vitro fertilization for many of our patients is that they may have a condition where the egg count is low. Perhaps their partner has a condition where the sperm count is low. We can overcome some of these challenges by actually taking eggs and sperm into the laboratory to facilitate fertilization and creation of embryos. For others of my patients, they're a little bit older, perhaps over 35.
Application in nursing: the nurse can help you to understand how the baby works the possible risks.
Couples who have tried to conceive for a year with regular timed intercourse should seek fertility evaluation. Now that's for women under the age of 38. For those over the age of 38, they should seek a fertility evaluation sooner, typically after 6 months. So a fertility specialist is actually called a reproductive endocrinologist, and it's an individual that's done 3 additional years of subspecialty training beyond their 4 years of OBGYN training. And they specialize in the use of hormonal injections and the creation of embryos in the laboratory. That's what separates a reproductive endocrinologist from a general gynecologist. It's an intimate and long journey, and you have to pick the right doctor. So I always encourage patients to interview their doctor and make sure they're comfortable.
The woman does not suffer any physical damage to the treatment. This treatment cons. This method is more expensive than other assistance reproduction treatments. Also, urinary
Vitro fertilization,
is
which is commonly known as IVF, it's a type of fertility therapy where eggs are removed from the ovaries, fertilized in the laboratory, and then embryos are transferred back into the uterus. IVF has been around for over 30 years, with the first IVF birth being in 1978, and it's estimated that over 3 million babies have been born from IVF procedures, and in the US each year about 1% of all births are from in vitro fertilization cycles. In vitro fertilization does have many steps, but I think once patients understand the steps, it's not as complicated as they might think. The first part is actually making sure that a patient is a good candidate for in vitro fertilization, and that involves some basic tests done by the physician before the cycle even begins. Then there's a time period where medications are used to stimulate the ovaries to make multiple eggs. We then are able to retrieve the eggs from the ovaries through a very non-invasive procedure called an egg retrieval. The eggs are then fertilized in the lab, and the embryos grow in the lab for anywhere between 3 and 5 days. And at that point, we transfer a certain number of embryos, which depends on the age of the patient and the quality of the embryos, back into the uterus. The best candidates for IVF tend to be patients with tubal factor infertility or severe male factor infertility, although patients who have tried other types of fertility therapy and have not had success are also candidates to consider in vitro fertilization. One thing to remember, though, is that the ovaries have to be able to make a sufficient number of eggs for in vitro fertilization to be
used. Applied in Ecuador, the success rate is vitro fertilization IVF remains modest. The probability of live birth is approximately.
Hi friends, I am Dr. Narendra Gupta, consultant gynecologist and IVF expert at Vivekanand Hospital Fertility Center, Jaipur, India. Today we will be talking on endometrial scratching. Many a times patients they ask us about endometrial scratching because their endometrium was not proper in the previous cycles. So many patients they come to us that the doctor has advised them endometrial scratching. So what is the need for the endometrial scratching? So before discussing endometrial scratching, I would like to draw your attention to what is endometrial thickness. Whenever we do embryo transfer, we need good endometrium. And what we mean by good endometrium, that is the endometrial thickness should be more than 7 to 8 millimeter. Endometrial thickness, endometrium is the inner lining of the uterine cavity where the embryos are implanted. So we need good thickness of the endometrium as well as we need good blood supply to the endometrium. So these two things are very important. One is thickness of the endometrium and second is blood supply to the endometrium. If these two things are good, then the chances of implantation are more. If the endometrial thickness is less than 7, then the chances of endometrial embryo implantation are less. But when it is less than 5 mm, then the chances of implantation are almost negligible. So the endometrial thickness is very important. So when your doctor or when we see that the endometrial thickness is much less than what is desired, that is it is around 4 millimeter, 5 millimeter, 6 millimeter, then we cancel the cycle.
Conclusion: endometrial scratch is not resolved in the half rate of life, where the no intervention are women undergoing IVF.
Involved in the menstrual cycle is the hypothalamus and the pituitary gland. Here is the lower female tract. We are zooming into the right ovary. A woman of reproductive age has many follicles within each ovary, ready to develop each month. The menstrual cycle is typically 28 days in duration. The menstrual cycle at day 1 begins with the release of gonadotropin releasing hormone, or GnRH for short, from the hypothalamus. GnRH stimulates the pituitary gland to release follicle stimulating hormone, or FSH, and later luteinizing hormone, or LH for short. Follicle stimulating hormone travels to the ovary where it stimulates the development of some follicles. During the development process, the follicles will produce estrogen, an important hormone for female menstruation. By day 14 of the menstrual cycle, estrogen levels are so high now that it will stimulate luteinizing hormone release from the pituitary gland. With luteinizing hormone being released, it will trigger ovulation of the most developed follicle in the ovary. The follicle ovulates, releasing an egg. The egg will then travel along the fallopian tube and will either be fertilized by the male sperm or not. The follicle that just released the egg will then become the corpus luteum, which slowly degenerates until day 28 of the menstrual cycle. Along the way, while it degenerates, the corpus luteum produces